That is one of the main issues that people are having at the moment. The second is, of course, we're coming up to UCAT time. Now, I think it's still very early for UCAT preparation, but I think if we have somewhat of a plan ahead of time in place, then people will at least rest easy that they don't have to worry too much about UCAT at the moment. But I'm going to talk you through kind of like the preparation plan and how I recommend going about UCAT. Okay. So firstly, I think with all things, with any achievement you want to reach, you have to start with a goal in mind, right? And with UCAT, it's pretty straightforward. But I would say that you have two aims. You either say, I have a university that I have in mind, and I know that I need to reach a certain UCAT score to get in. So, for example, you could say, I don't know, I want to go to Bristol, and I know that in 2019, for example, they had a threshold of 2,730 to be invited to interview. So that's the thing that I've got to aim for. On the other hand, your goal could be, well, I'm just going to do my best, get as high a score as I can, and then use the data once I've got my score. Because remember, you get your score immediately after sitting the exam. You don't know how that compares to other people, and we'll talk about that in a minute. But you get your score straight away, and as long as you do it early enough before the application's closed, then you can say, well, I know that this will get me into X, Y, and Z university, so then you tailor your application accordingly. So, I mean, I'll talk a little bit about UCAT and how, just to give a bit of context of like what a good score is and kind of what we're aiming for, and then how we're going to aim for that or prepare depending on the kind of score that we want or the kind of score that that we get once we have been given it. So, as we know, UCAT is out of 3,600. So that's 4 sections, all scoring from 300 is the minimum per section, 900 is the maximum per section. So the minimum you can actually score is 1,200. And then the 5th section, which is the situational judgment, the SJT, that is banded from 1 to 4. So 1 being the highest, 4 being the lowest. And so when it comes to the university requirements, some divide it into sections and say you can't go lower than a certain score in any given section. Some people say that they want the SJT to be a certain score, and some just say your average score needs to be of a certain number. So the thing that we need to look at is what is considered high, what would represent a good outcome. So typically, looking at the data, a score above 650 per section would be a good score, and about 680 and above would be a very high score. So let's see, looking at the UCAT scores from 2020, a good score was between 640 and 670, and a high score that year was over 670. But the average score changes each year. So it's generally you want, so the average UCAT score for 2019 was about 620. So that's an average. So, we're talking about typical scores for a good score, a high score, and then the average. So the average score per section in 2019 was 620. And for 2020, it was 628. So it doesn't vary too much. And the things that I'll show you some data, some hard data in a minute. I'll share my screen. But students usually struggle most with the verbal reasoning. So the average score is usually around 570. Then people are typically most comfortable with the quantitative reasoning, and the average score for that's usually about 6, 7, 8, something like that. So, and then what else is there? What have I missed? The abstract reasoning scores, they tend to fall between 630 and 640, and the decision making is probably the one that varies the most. Okay, so I'm going to share my screen now. I'm going to show you some data that I've gained from, I think it was from the Medic portal. Where did I get this from? Okay, so tell me when you guys can see my screen. Okay, so this is the, let's start with the top one. So this is the UCAT score by decile. So if you have a look, to score in the, so the 10th decile obviously is the top decile, so the best. So typically to score highly, you need to be hitting between, depending on the year, 2,700 and 2,900, okay? And so that correlates to about 75 to 80%. And as you can see, the low score is typically standardly around kind of like 2,100, 2,200-ish, okay? So then this is looking at the average UCAT score per section per year. And we can see that, you know, I was giving you those figures before, and they vary a little bit from year to year, but it tends to be that the verbal reasoning is the toughest, quantitative reasoning tends to be the best, the decision making is quite variable, and then the abstract reasoning is kind of somewhere between. And then looking finally at the SJT score distribution. So you can see here that really to be scoring well, you need to be getting in bands 2 and 1. 1 being the highest, 1 and 2 being the highest. So, yeah, that is the kind of thing that we're aiming for. Let me just, does anyone have any questions at this stage? So I've done a lot of talking. No, anyone?
Can you retake the UCAT test?
You can only do 1 UCAT test per cycle. So if you, yes, so no, essentially, no. You could, if you don't get a great UCAT score, there are universities that look less at the UCAT, but yeah, so other than that, your alternatives are to take the BMAT or to apply to a university that doesn't take that doesn't value UCAT as highly. Okay.
Sorry.
Cool. Yeah.
What if we do good in other sections except verbal reasoning?
Except verb. So usually so like I said, this is down to individual universities, right? So some will say no one section can be lower than, but usually the way it will be is they might demand quite a high average score, but actually the individual sections, the minimum is quite low. But that's only because they don't want people who say are really like a whiz kids at maths and get a 900 and then get a 200 in verbal reasoning, for example, and average out to quite a good score. So it's just usually the lower threshold is to kind of weed out people who are really weak in one area. They want people, because the whole idea, and we'll go through this, the course will be ready in, maybe the next 6 weeks, but we go through this because we talk about why they do these examinations, what is it they're doing this for. And the reason that you can't be too low, some universities say you can't be too low in one given area, is because you need those skills. So verbal reasoning is because you have to read through a lot of material. When you get a new patient and you want to familiarize yourself with what's going on, you have reams and reams of notes, but you have to read through a lot of it quite quickly just to get a flavor of what's going on with the patient. Quantitative reasoning is because you need to have a reasonable level of math skill to be able to, to do drug calculations and deal with any of the numbers that are involved in diagnostic tests. So they want to see that you have, and then the others, SJT is looking at how you handle situations. So it is literally situational awareness, and decision making is your logic. So you need all of those components to make a good doctor. And a good doctor can't really be really skilled in one of these areas and really flawed in another, because the weaknesses, the strengths don't compensate for the weaknesses, and the weaknesses can be potentially seriously harmful. Okay, to answer your question?
Yes, thanks.
Okay, good. Cool. Okay. So I want to talk a little bit about preparation. And I want you to think of the UCAT it's like sprint training, because I'm not saying that you want to sprint to prepare for it, but it is like training to be a sprinter, because the UCAT is 2 hours of absolute mental bombardment. It's intense, it's fast-paced and pressured against the clock, and it is like a mental sprint, if you will. Right. So so think of it as like your high-intensity training. Now, the way sprinters train, not trainers sprint, the way sprinters train is, you can imagine how Usain Bolt would have trained, is that he will do a sprint, then take really long rests, sprint again, take long rest, sprint again. Because you can imagine, say if you were doing a HIIT workout or you were doing sprint training, if you sprinted incessantly for 5 hours, you would absolutely burn out, and the chances of you making progress would be, zero. Because, there's something called the point of diminishing returns, right? So it's a point where the more work you put in, you get better, you start to plateau, and then at a certain point you actually start to do worse. And that's a sign that you have been doing a bit too much, because, like I say, it's performance-based as much as it is knowledge-based. So what you're doing is training yourself to be a good sprinter. You're training yourself to perform well at the exam on the day. So that involves lots of simulation of the test. So simulating the conditions, simulating that sprint, that pressure, that having to think under time constraints. And that is the goal. That is what you want to aim for. Because what you want to do is just get used to and get comfortable with thinking and solving problems in that environment. And like I say, that's why what you want to do is develop a baseline knowledge, and you want to learn the techniques for how to do things efficiently. You want to get that down. You want to have your core understanding of how to navigate UCAT first. And that is, that is putting in the hours. That's just getting your head around, well, what's the best way to do this? What's my technique? And that is fine. You can, that you can put the time in to learn. But what I would impress upon you is you need to start simulating the test as much as possible. The best way to get good at something is to do the thing as much and as often as possible. And that means doing it against the timer, doing it under stress, doing it even in a difficult situation. Even we don't know whether you'll be at home this year or whether you'll be doing it in the centre. They keep changing their announcements, but even when you're in a test centre, which is supposed to be exam conditions, you'll still have that guy next to you sniffing or mouth breathing like Darth Vader. You're just trying to concentrate, and he's there going. So it's like even the best test conditions are distracting, and people always talk about in the test centre they found it really hard to concentrate for their UCAT. So we're trying to prepare ourselves to operate under these conditions, and perform no matter what the circumstances are. So we can't do that sprinting for 5 hours a day. You'll drive yourself mad, and like I say, you'll hit that point of diminishing returns. And yeah, the biggest warning sign that you're doing too much or not taking long enough breaks between sessions is that your score's getting consistently worse. Okay. So I think so people ask about when to start revising, and I'll come on to that in a minute, but really what I would say is you want to work out what you need to get out of the UCAT. And I think the best thing that you can do is do a mock test early on, because that will be your calibration tool, because you will then know where you're at now, what needs work, and kind of what you need to improve on. Because, you know, that's the ultimate in goal setting, isn't it? That you know the destination. So, you know, like I say, we set the goal of whether it's to get a certain threshold to reach a university or just to do our best. Then we calibrate by knowing where we are, and then we just work out what we need to do to close that gap. And that is kind of the ultimate goal setting to achieve any ambition that you want to do. That is the way that you achieve it, right? You identify the goalpost, know where you are, and work out how to close that gap. And yeah, that will gauge how hard you need to work, how much time you need to allow. Again, the burnout from UCAT is a real thing. I always say a couple of months is usually enough, maybe 3 at a push. But and like I say, if you do that mock test early on, work out where you're at, then you know how much you've got to do. Because, you know, if you're doing well and you're scoring well and you're looking like you're probably going to end up in the top decile, do you really need to run the risk of burning yourself out when really all you need to do is probably a month's preparation and you'll you know, meet the standard? So it's very personal to you. It's knowing where you are, where you want to be, and how to get there. Okay. So, like I say, the question that people ask is, when is the right time? And if you guys have had your strategy meeting with me yet, for those of you who still need to have it, the first thing we do is plan out your year, right? So if you have printed out that timeline, the best thing to do is identify all the key dates that are important to you. So you need to know when your exams are. You want to know kind of when your school year finishes. Then you want to know kind of like what's happening in September when your school year starts, or whatever, you know, if you're not in school, what important dates you have, any even silly things like weddings that you have to attend. Just, you really want to pick the optimal time to give yourself the best chance of scoring well. Now, that means that you want to allow a good amount of time to prepare, and you want to have it minimally impact your exams or anything important, or like even your medical school preparation that you have to do in the interim. So it's a combination of giving yourself enough runway to give yourself the preparation time, but at the same time not encroaching on your other responsibilities. Now, the one thing I'll say, so the first UCAT sitting this year is July 26th. And I would say you want to have your UCAT done by the time, if, again, this is personal to you, it might not work out for you like this, but ideally, if you can have your UCAT wrapped up by early September, and that means, and if you have to be organized as well to make sure your personal statement's cooking nicely at the same time, but if you can have that done by September, then you're in a position to make your university choices or alter your university choices based on the score that you have. Now, remember, the score is, it's your score, and it doesn't tell you what decile you are definitely in, but, you know, you can gauge it on previous scores and previous years to say, well, you know, this is generally a good score, this is generally an okay score, this is a bad score. And then, you know, you might have to rethink your strategy to apply to medical school at that point. Or you might be pleasantly surprised and be like, actually, maybe I could go to a more higher score demanding university. So you could be pleasantly surprised as well. But it's all about planning the process to maximize the chances of you scoring well by giving you lots of prep time, and minimizing the burden and the hindrance on the other aspects of your application, your life, and your school, or whatever it is that you're doing. Okay. And the final thing that I would say is learn the stuff early on, and then just do questions and do them timed. And I was speaking to Ali Abdal yesterday, actually, and I was saying to him, like, you know, should I try and make a question bank? And he was like, dude, don't bother. He said, in his words, he said he tried for 4 years to make one, and he, you know, and if you know who Ali Abdal is, he's a big, you know, well, he's big in the tech world. He's a doctor, but he's really good. He's got over 1.4 million followers now. He's a big name. And he said even he couldn't do it. And he said it was an absolute nightmare. He said there is no better resource out there than Medify. So just use Medify. Use that resource that's the best one. And it also gives you the opportunity to time your exam. So time your practice. So you can, again, it's what I say, simulate the test as much as possible. And that is what's going to help you score well.